Hey, so hi there, it's Dr. Glenn Davies coming to you from the greenhouse for reverse T2 diabetes topor and for reversal NZ. So today I'd like to talk about the topic of long COVID. Now, this has been a really difficult topic to research. So I've just really written myself some notes. I started by looking at Health Navigator and the Ministry of Health sites to see what advice they give. On those sites, there's some excellent information about long COVID, but very little information on treatment. They make the comment that as this is a new condition, most of the research is still in the early phases, and it's very difficult for them to give evidence-based advice on how clinicians should be managing long COVID. Another thought I had is that it's likely that the treatments for long COVID will be similar or the same as the treatments for some of the vaccine injuries. That's my assumption. So I then went and had a look at some of the other sites. The doctors that are doing most of the work in this area are probably integrative or functional medicine doctors. And I will say that they are basing their recommendations on their experience and also from treating other similar conditions. An example of that might be people with fatigue following glandular fever, or it might be chronic fatigue syndrome. So basically summarizing some of that information, particularly an article from the World Council for Health. And these are also some of my own ideas. Absolutely, this does not constitute medical advice. This is really just a discussion around some of the thoughts that people are publishing in this area. So, first of all, food. Food will be essential for anyone who has long COVID. My advice is that you have whole foods, that you avoid sugar, you avoid ultra-processed carbohydrates, you avoid the polyunsaturated vegetable oils. So a whole food diet. I personally would encourage you to consider keto, which is a fast mimicking diet. So a ketogenic diet or a low carb, healthy fat diet, a fast mimicking diet, remembering that fasting is where apoptosis occurs, which is cell repair and cell recycling, and also to consider intermittent fasting and fasting. Sleep is going to be important as always, and then rest looks like it's really important in the treatment of long COVID. Remembering that all animals will rest when they are sick, accepting that it takes a lot of energy for the body to mount an immune response. And if we're expending that energy going for a run, for example, there's less energy available for the immune system. Movement. I think it's important that we are not doing really heavy exercise during this time when we should be resting and recovering. Relationships and community, and I think what's really important is that you have a relationship with a health professional that you trust in this area. Saunas, particularly the infrared sauna, is likely to be useful in this condition, and hydration, of course, is going to be really important. But the main sort of crux of this is around supplements, herbal medicines, and repurposed medications. So these fall into several different groups. So first of all, spike protein inhibitors, and there are quite a number of these repurposed medications and herbal treatments. So there is Prunella vulgaris, there is pine needle tea, and pine needle tea is a detoxifying agent. Emodin, neem, dandelion leaf extract, and the ivermectin. The ivermectin, of course, has been shown to reduce the spike protein binding with the ACE2 inhibitor. And then there are spike protein neutralizers. The most important one is N-acetylcysteine, and that's been shown to reduce the binding affinity between the spike protein and the ACE2 receptor by a factor of 3. So a threefold reduction in the binding affinity between the spike protein and the ACE2 receptor, recognizing that that is how the COVID-19 virus gets into the cell. Glutathione, fennel tea, star anise, pine needle tea, St. John's wort, comfrey leaf, and of course vitamin C. Vitamin C being such a powerful antioxidant. And then substances which protect the ACE2 receptor: ivermectin, hydroxychloroquine with zinc, quercetin with zinc, and fisetin. And then anti-inflammatories, particularly those that target interleukin-6, so boswellia, dandelion leaf extract, black cumin, black cumin seed, which is Nigella sativa, fish oils which contain omega-3s, cinnamon, vitamin D3, magnesium, and turmeric or curcumin, and then the fermin inhibition to prevent the cleavage of the spike protein. I've said that wrong. Furin. I meant to say furin. So that is rutin, limonene, bicalene, hesperidin, and then serine protein inhibition. So green tea, potato tubers, blue-green algae, soybeans, N-acetylcysteine or NAC, and boswellia. And also mentioned is milk thistle extract. So in addition to that, I've been looking at the iRecover protocol, which is from the Frontline COVID Critical Care Alliance. They tend to use a lot more repurposed medications. So they talk about ivermectin, prednisone, low-dose naltrexone, which is LDN, omega-3s, vitamin D, fluvoxamine, which is an antidepressant. The closest we have in New Zealand is Prozac, the turmeric, and melatonin. There was also an article from a Dr. Patterson. He is using medications. He's using an HIV drug, which is called Maraviroc. Also a statin. So the statins are cholesterol-lowering medicines, but they also have an anti-inflammatory effect, and the ivermectin. Now this hasn't been mentioned in the articles which I've looked at, but from my personal experience, I expect that intravenous vitamin C, so vitamin C given in very high doses into the vein, directly into the vein, is likely to have a positive impact. Basing that on the very positive impacts I have seen with people with fatigue following glandular fever and with chronic fatigue syndrome, especially if that is combined with magnesium, and it can also be given with N-acetylcysteine, so that is available orally, and glutathione, which can be given intravenously as well. So what are the top 10? So vitamin D, vitamin D3, particularly if combined with vitamin K2. Vitamin C. So vitamin C can be given intravenously. It can also be taken orally. And people's ability to absorb vitamin C increases when they're unwell. So if you were only tolerating, say, 1 or 2 grams when you're well, you might find that if you are sick with long COVID, you tolerate much higher doses. And we talk about titrating to bowel tolerance. So taking vitamin C until you get loose bowels and then dialing it back a little bit. The N-acetylcysteine. The ivermectin. Now, ivermectin, of course, is difficult to obtain at the moment, but it is still available. Black cumin seed or nigella, the quercetin, the zinc, the magnesium, the turmeric, and the milk thistle extract. So this has been a really difficult topic to discuss and to research. There's I would say that the evidence is definitely not level 1 evidence. We're not seeing the randomized controlled trials that we would love to see. So clinicians are basing their advice on their personal experience from treating people with long COVID or with vaccine adverse reactions. They're also basing it on first principles, concepts around anti-inflammatories, around reducing the binding of the virus with the cell, so looking at the spike protein itself and the ACE2 receptor. So it's first principles, it's their experience, and it's their experience with treating similar conditions. Particularly that chronic fatigue syndrome. So please don't take this as medical advice. Take this as a discussion around some of the options that you might consider if you feel that you are experiencing persisting symptoms from COVID-19 infection. The common ones are fatigue. There are persisting respiratory symptoms, persisting cardiac symptoms, and persisting neurological symptoms. So that's an initial discussion on a complex topic. I hope that's of interest. Enjoy your evening.